Today I will be discussing how medical school works. For those of you who are interested in going to medical school, or those of you who have been accepted into medical school recently, congratulations. Let's just get into it. I'm going to talk about the medical school years in general because I know that every school has their own curriculum, so I'm not going to go into scheduling too much and what my typical day in medical school looked like. I wrote about that in my blog if you want to take a look at it, because like I said earlier, each medical school has their own curriculum. For example, my medical school, we had lectures, small group, anatomy labs, simulation labs, but some medical schools might not offer that. The first 2 years of medical school involve learning the basic sciences, usually in lecture format. Now, the first 2 years of medical school are very similar to undergrad in that you wake up, you go to lecture, you sit in your lecture hall, you listen to the professor. He or she may choose to use a PowerPoint presentation to teach, and you take your notes, you can ask your questions, and then you go back home or maybe to the library, the study hall, and you study. You can have more than one lecture per day. Depends on the medical school you go to. For example, at my medical school, we had about 2 lectures per day, and each were about, I would say, an hour and a half or 2 hours long each, if I recall correctly. So let's just say a total of 4 hours of lecture per day. It would also depend on the day. Maybe on holidays we didn't have any lecture, for example, or we might still have lecture. It really depends on the medical school and how they've set up their curriculum. What are you learning in those first 2 years of medical school? Many things. You'll learn about physiology, about pathology of the different organ systems. You'll learn about pharmacology, the different drugs that you can use to treat different diseases, and when you should use those drugs and when you should not use those drugs, when are they contraindicated. You'll learn about the different body systems, the brain, the eyes, the anatomy, the musculoskeletal system, the digestive system, everything. And these are part of your basic sciences. In the first year, at least at my school, we didn't go into pathology just yet. We stuck to the physiology of different organ systems, and we also had the foundations of medicine. So what does that mean? That's kind of like a lot of the stuff that you learned about already in your biology classes during undergrad. That would be like learning about DNA methylation or about DNA replication, genes, genomics, and some genetic diseases as well, like osteogenesis imperfecta, for example, or sickle cell disease or Huntington's disease, and you learn about the genetic basis of those diseases. Also some cell biology, your microfilaments, your microtubules, all that fun stuff. And if you're pretty good at biology, it's kind of like a review in a way. We don't go into chemistry, organic chemistry, or physics. So for those of you who are pre-meds and you're worried, I don't really understand physics or how that fits into medicine, or I didn't do really well in my organic chemistry class, or do I need to know general chemistry? Guess what? You don't. The only times that we've seen organic chemistry structures in our lectures is if the professor was just showing it on a slide and saying, "Don't worry, students, this is a scary image, I'll admit, but you don't need to know it. I'm just putting it there in case you want to know what it looks like, but you are not being tested on it. You do not need to know about it." So all that stuff that you learn from organic chemistry, general chemistry, physics, you don't really need to know for medical school, to be quite honest. First year, we learned our foundations to medicine, the genetics, the cell biology, all that stuff. And we also learned about the musculoskeletal system. We learned about some anatomy, and we also went into CPR, or cardiology, pulmonology, and renal. We only touched on the physiological part of it, not the pathological part of it. That came later. So that's what we learned during the first semester of the first year. The second semester, we learned about the brain, the nervous system. We learned about the digestive system, and we went into the physiology. Every medical school is different. Curriculum's different. This is just my experience. The second year of medical school, we went more into the pathology, which means the diseases that you see in different organ systems, like the heart. It would be like heart attacks or cardiac tumors or different conditions that involve the heart and the symptoms that you'd see, the differential diagnoses. And we also learned about drugs used to treat those conditions. And we also learned about the public sciences part, and that involved some statistics. So you do need to know a little bit of statistics in medical school. I mean, I would say that even if I didn't take statistics in undergrad, I still would have done fine in that public sciences course because it was just very simple math. And some examples of statistics problems would be standard deviation, or finding the mean, finding the median, finding the mode, or variance, or chi-squared, or ANOVA, and they go through that with you in medical school. At least at my medical school they did. But basic math like that, you don't need to know calculus or anything of the sort. Public health sciences involves a couple of different things. It's not just about statistics and finding mean and mode, but it's also knowing a little bit about different healthcare systems like Medicare, Medicaid, and also ethical stuff, like ethical questions like, can you remove a ventilator from a patient who's brain dead even though the family wants to keep the ventilator on the patient? So first 2 years, basic sciences, mostly lectures. At my school, for example, we had something called small groups. Small groups are basically when 6 to 8 students are assigned to one group. Those students are led by a facilitator who is usually someone with an MD. That facilitator would guide a discussion regarding a certain topic during that day. So it could be on histology, for example. The facilitator would present histology slides on a computer screen, and all of us would talk about those slides. We would answer questions. Sometimes we had to pre-prepare, so we had the questions in advance, and we would split it up between each of us. And like, for example, Bob would do questions 1 through 5, Katie would do questions 6 to 10, I would do questions 11 to 15, and we would answer them on our own, and then we would come ready to small group and answer those questions in front of the facilitator. We'd have a group discussion. We would also ask questions to the facilitator. If there are things that we don't understand and want clarification on, the facilitator would answer our questions to basically reinforce the material that we learned during lecture, and also help guide us, answer our questions as well. And it was a great active learning experience, especially if you had a great small group of people. And we would have those kind of small groups at least 3 times per week, and it would be on different topics related to lecture, of course. So it was almost like a mini study session. It would last 1 to 2 hours long, depending on what we were doing during that time. We also had ultrasound sessions where we would learn how to use the ultrasound machine. We had anatomy lab where we would go into anatomy lab and there's a bunch of cadavers laid out and covered with sheets. We didn't have to do the dissecting part because that was already done, but we'd basically see where all the different anatomical structures are in relationship to each other, and we'd also talk about what those anatomical structures do, what is their function. We'd also get tested on what we learned in anatomy lab as well. And we also had simulation lab where we got to work with patient robots and figure out what was wrong with those patient robots. And you can actually put the stethoscope on the patient robot and hear the heartbeat. My school had a lot of different ways to reinforce knowledge for students. Again, every medical school is different. Not every medical school offers these small groups or simulation labs, things like that, but it's just an example. If you want more information on my experience during my first 2 years of medical school and exactly what we did, then I wrote about that in my blog, and you all can check that out if you'd like, and I might even make a future video about it for those of you who are interested. So first 2 years of medical school, basically like undergrad. Go to lecture, you learn from lecture, you take your notes, you do your studying, and you take tests based on those lectures, etc. What about the last 2 years of medical school, the 3rd and 4th years? Well, those are clinical rotations. The 3rd year of medical school, we have to do our core medical rotations. That's pediatrics, family medicine, OBGYN, psychiatry, internal medicine. If you start off with family medicine, you'll go into a family medicine department at a hospital. You would follow a physician around, to put it quite simply, and you would learn from that physician. You would see the different patient cases. You could help out with different patient cases as well, talk to the patients, interview them, and be as hands-on as you are willing to be, and as hands-on as the attending you're working with will allow you to be. And it's basically like shadowing, but again, more hands-on. You're there to learn as much as you can possibly learn. And after each of your cores, you will take something called a shelf exam. A shelf exam is a 110 question exam, and it's basically testing your knowledge in that department that you rotated in. So for example, if you rotated in OBGYN and you are near the end of your OBGYN rotation, you're going to take the shelf exam, which tests your knowledge on OBGYN. And then the same thing happens for family medicine. You take your family medicine shelf exam, and then you do that for each core. Now, during your late third year is when medical students typically apply for residency. So you get all your documents in, your letters of recommendation, you take your step 2 exam, and then during your 4th year are electives. So at my school, we schedule these ourselves. It's like you can rotate through any specialty that you want to rotate through or you want to learn more about. So you could rotate through radiology at a hospital, or you could do surgery again, but at a different hospital. And you have to keep in mind that it may involve a lot of out-of-pocket costs. So if you want to do an elective rotation outside of the hospital that your school is affiliated with, then you might have to pay certain out-of-pocket costs. And those costs depend on the institution, the hospital that you are going to rotate at. And sometimes you have to fill out application forms, pay application fees. And during the process of finishing your 4th year electives, you might be called for interviews for residency. And then finally you graduate. So first 2 years, similar to undergrad, basic sciences. After the first 2 years, take your step 1 exam. 3rd year, core rotation, step 2 exam, apply for residency. 4th year, electives for the most part. Once you start medical school, everything will start to fall into place and you'll get a better understanding of how everything works. So many people have done it, so don't worry if you feel confused in the beginning. A lot of us feel that way, but you're going to get used to it and you're going to know what you need to know. If you still have questions, feel free to ask me. Happy studying!